Everything points to ALS.
Then no MRI. And I want one of them papers to say, I don't want nothing done if something go bad.
A DNR? Mr. Giles, you don't want to rush
It's
into...
been 2 years. I ain't rushing. I want to sign one.
He signed a DNR.
He rhymes with dinner?
He signed a DNR.
Oh, that makes more sense. You tell him it might not be ALS?
No,
Well, no wonder he signed. Who wouldn't?
he doesn't want anything done. No treatment.
DNR means do not resuscitate, not do not treat. You do nothing. Doesn't matter which one of us is right.
This is an important scene that highlights DNR, do not resuscitate order, often commonly seen in the hospital. First, you always want to assess a patient's decision-making capacity when you ask this question. In essence, not only are they alert in order to times 4, you also want to make sure they understand the risks and benefits of treatment versus no treatment, and if they're able to communicate a logical choice. Next, there's more to a DNR order than no chest compressions. You also have a DNI, meaning do not intubate, and the two can be separate. For example, you can be a DNR but not a DNI, and vice versa. Though often you explain to the patient that if they are just do not intubate, then in the scenario where your heart stops and you undergo CPR, intubation oftentimes go hand in hand with that. Now, a situation in which you can be DNR but not DNI is if, for example, you have a respiratory failure from causes like COPD or heart failure. Being on the ventilator may be short-term until the team fixes the underlying problem. There are also other things that are also in a DNR order, such as does the patient want any shocks given to them if they are in a dangerous arrhythmia? For example, AFib with hypotension, where you are not necessarily pulseless, but to get you out of AFib, they may need to consciously sedate you and then shock you. You also want to ask if the patient wants any central lines and are okay with pressors, in essence medicine to keep their blood pressure up, which can prolong their life a little bit. Just know that there is so much more to a DNR order. The best thing is to really talk about this stuff while you are healthy and when you see your primary care doctor. There is something called a POLST, which stands for Physician Orders for Life-Sustaining Treatment, that you can talk about with your doctor and sign.